So observational research, okay, this is definitely a very kind of another branch, right, of research methods. And we've spent a lot of time thus far in the class talking about experimental methods, right? Things where we have variables under our control, where we're able to manipulate independent variables and test their outcome on a dependent variable, right, as is common in experimental designs. But today we're going to shift gears a little bit, and we're going to talk more about observational research and why that is, why not only is it's important, but what some of the methods actually are, and some of the designs are within those observational types of studies. Okay, so let me go ahead and dive in here. Sorry guys, that's my dog. He just decided to drop a 20-pound ball on the floor while I was trying to talk every time. All right. So observational research, okay? So ultimately, right, observational research, this is really truly a different paradigm. So when we are trying to examine, right, and or study things that happen within the natural environment, maybe we're trying to solve larger problems in society, whether that's, studying the development of children, whether that is, maybe kind of trying to study or solve, excuse me, or solve some sort of a disease. Geez, so sorry, you guys. Okay, sorry guys, let me grab some water. I'll be right back. Okay, so with observational research, right, we are attempting to really make observations about groups, right, or about people, or within the environment as things occur naturally, right? So we are attempting to solve, generally, create questions and solve problems, and study those things within the environment as a whole, without actually controlling variables, tightly. Okay. So ultimately, right, exploratory research and observational designs do go hand in hand. So exploratory research is essentially, systematic investigation of relationships between two or more variables, right? And the goal, right, the goal always when we're looking at these types of studies, right, at these types of observational studies and or exploratory type research, we always want to try to establish a cause and effect relationship. That is really what we're going for, right? Wanting to establish a connection or a cause and effect between one variable and another, right? So a lot of times, right, we also use things like hypotheses in observational designs. However, we word them differently, right? So ultimately, we make these hypotheses, but we're utilizing different factors, and we typically refer to these things as risk factors, right? So the independent variable typically would be like a risk factor, generally speaking, like obesity, right? Whereas the clinical outcome, for example, in this question, could be the rate of diabetes. So a question could be, right, in an observational type of setting is, ultimately, what are the rates of type 2 diabetes in obese Americans aged 30 to 45, right? Or conversely, right, how does obesity with a BMI greater than 30 affect the rate of diabetes in participants aged 30 to 45 in the United States, right? Now, you can see how we're attempting to really kind of plug in a very specific risk factor, and we're still using that PICO format, right? We're still using the exact same format within, the question itself, but, the variables are not controlled, right? They are things that people naturally possess, right, within themselves. And it's not something that we are attempting to manipulate. All right. Okay. So here's the deal. All right. The one thing that we have to our advantage, particularly when discussing these types of these types of designs and studies, is we have the ability to utilize time to our advantage, right? Whereas, right, with an experimental type of design, time is usually a limiting factor for us and can even be a variable that we have to contend with in a lot of our designs. Okay. However, right, with time, we can actually utilize that not only in formulating questions, but also in conducting research. So, one example of how we would do that, if we were looking at a group of people, right, and then following them from the current point in time forward, right, that would be a prospective approach, okay, which means measuring data at a present time and possibly throughout the future, right? So right now, and then possibly into the future as well. Okay, so conversely though, okay, a retrospective approach. Okay, a retrospective approach, as we talked about kind of briefly in the last kind of part of the class with the introduction method section, okay, we're actually looking backwards, right? So we are looking backwards in time from a certain point to attempt to really kind of link a certain risk factor with it, with a disease, okay? Now, clearly, right, it's really important that if we're going to be looking at things in a retrospective fashion, it's important that our data be high quality. Okay, it's really important that that data is high quality. Now, here's a question for you guys, though. All right, what do you think? What is a way that you think someone would be able to potentially study something retrospectively? What would they typically have to have at their disposal, or what's one thing that they might use to measure that data, or to even have access to that data? All right, so nice. We gave it the old college try, but okay, here's the deal. Right, so these types of studies, generally speaking, people will be pulling this data, these types of data from databases, right? And they'll actually formulate their research question based on information that might be present in a database. We're going to talk more about that in a minute, right? But that ultimately is one way that people typically tend to look at things retrospectively. We talked about also in the kind of in previously in the class how oftentimes studies that are retrospective in nature may look back at like medical records, for example, to attempt to determine the presence of a some sort of risk factor and or determine the cause of a disease by looking backwards at medical documentation in a specific population of people. Okay. All right. So talking about prospective studies, all right, we need to be really, really kind of intentional, right, with how we describe them. Okay. So ultimately, prospective studies can take on really two distinct forms. Okay. These studies can be longitudinal in nature or cross-sectional. We're going to kind of go through some of those differences right now. So a longitudinal study, right? First of all, obviously we know just from looking at the slide that a longitudinal study actually follows subjects, right, over a course of, over a course of time. That could be months, but often with many longitudinal studies that are done today, right, that happens over the course of years. So there are many different studies that have been put in place that follow patients or follow participants longitudinally. And these are often used to study clinical problems. An example of that, right? We have out of the University of North Carolina, Chapel Hill, we have the Center for the Study of Retired Athletes, right? So we're following these retired athletes throughout their lives up to death, right? to not only, assess the quality of life that they have, but also to look at any concurrent diseases or medical comorbidities that they may develop. And does that make them different or the same when compared to the general population, right? So one of the longest running longitudinal studies that we have to date, right, is the Framingham Heart Study. And so the Framingham Heart Study was started in Massachusetts back in 1948 to look at rates of basically rates of heart disease, right, over time. And that study is still ongoing today, right? There are, though, some issues or some threats with longitudinal studies, and one of those is attrition. So when I say attrition, what I mean by that is, people dropping out of the study over time, right? Because if we remember, with informed consent, in order to respect a participant's right, I always say patient, but in order to respect someone's essentially right to autonomy, right, in regards to informed consent, we have to give them the ability to drop out of a study at any point in time if they choose to do so, right? That is their right, obviously, as a participant. So cool. I think nearly all of us are here. We have 28 of us now. So moving right along. Okay. Now, check this out. This is, to me, I've got a little bit of a background in sports injury epidemiology. So to me, this is kind of cool. But ultimately, right, with longitudinal studies, we are looking at ways to describe risks, right, and describe outcomes, right? We want to know which populations are we defining as potentially at risk for a certain outcome. What's an example of that? So an example of that could be this. In collegiate, let's just say collegiate women's soccer players, all right? We believe that this cohort of people is at risk for ACL injury, right? For having an ACL rupture, right? Or tear of the anterior cruciate ligament in the knee, right? So ultimately, we're interested in studying that because we've defined our at-risk population. And so now what we do is we sit back over the course of years and we look at the number or the rate of ACL injuries that happen per given segment of time. In this case, we'll say a year, right? So as we continue to move down the line here, we can see this little arrow, right? And every circle, right, represents occurrence of injury, right, each year. So boop, boop, all the way down the line, okay, for a total period of 7 years, we looked at this data, all right? Now, this ultimately, okay, this is the incidence. So if we're describing the rate of injury in a longitudinal study over the course of time, all right, that is known as the incidence of an injury. So we could deduce, based on this data, based on the average over a 7-year period of time, that the incidence of ACL injury is approximately, we're just going to throw in a number, 100,000 ACL injuries occur every year. That's an incidence number, okay? And ultimately, and we gave an example here on the slide of concussion, right? So, approximately 3.5 million sport-related concussions occur every year. That is a statement of incidence, right? So looking at the number of occurrences in a given period, over a given period of time, right? Now, the cool thing is that generally speaking, in like public health or epidemiology, what we want to try to do is we want to try to have an effect, right? We want to try to establish some sort of method for prevention or a way to kind of address that problem over time. And so what we would hope to see is that if we're able to put in effective prevention measures, that the incidence of that injury actually decreases over time if we're successful. All right. Whoops. There we go. So conversely, though, okay, cross-sectional studies, okay, a cross-sectional study is different. All right. So this is where we study a group of people, right, at a specific point or a single point in time, and we describe the data, right, at that single point in time only. We don't attempt to follow it over the course of time, longitudinally over the course of a year, 2, 3, 4, 5, 6, or 7, or whatever, right? One point in time, describe the data, and that's it, right? So we use those to study clinical problems or make observations about groups, right? So one of the biggest problems, though, and this is actually kind of this is a really instructive point, right? But one of the biggest threats to cross-sectional studies are cohort effects. What in the world is a cohort effect? Okay. Okay. For example, let's say that we are looking at, in the example that we give here, let's say we have a cohort of 1 million people, right? And we're curious about, what effect, and so we're going to describe our risk factor here as being beliefs about cigarette smoking, okay, and the outcome, right, being rates of lung cancer or respiratory disease, right? How do beliefs about smoking essentially affect those rates of disease? For example, let's say that within our cohort of people, we have maybe 15% of that cohort that was born between the years of maybe 1935 and 1960. Just to name, just for, kind of to give a date range. But the problem being, during that period of time, there was actually media activity and advertisements and those types of things that actually promoted the use of tobacco as a healthy behavior, right? It was actually healthy. And so it wasn't actually known and or seen at that time that use of tobacco actually led to disease, right? So it was actually promoted to be something that was not only obviously socially acceptable, but also generally safe, right? So that very well could be that if we have people in our cohort that were born in that period of time, that some of those beliefs about tobacco use might still be held, right? I know that I had grandparents that smoked like a chimney until the day they died, right? And so ultimately, right, that's one of the main problems with a cohort effect, right? Is that typically the influence of generational kind of not only level of education but opinion and other factors can disrupt the data within that cohort. Okay, what's another example of that, right? So what about the social determinants of health? So if we're looking at rates of, for example, like rates of chronic disease and or let's just say access to healthy food, for example, right? So the social determinants of health, right, could also be another factor to consider. If we're studying, again, a cohort of people at one snapshot in time, right, it very well could be that if we have individuals within that cohort from a lower socioeconomic status community, that they may not have access to healthier food, right? They may not have access to the same type of produce, availability of fresh produce and those other types of things that those of us that may live in other communities may have access to, right? So that kind of summarizes and gives an example of cohort effects, right, within cross-sectional studies. All right, so here's the deal. What about, though, we've already talked about incidence. Okay, what about risk and outcome in cross-sectional studies? Okay, so ultimately what we're looking at here is we're looking at, once again, the people that have the outcome or disease of interest within this group of people, right? So clearly, if we describe, right, that the rate of the outcome that we want, or the rate of a specific disease, or the presence of it, okay, within a cross-sectional study, the number of people that have that disease or outcome of interest, that is known as the prevalence. Okay, the prevalence of that disease or condition within a cross-sectional study. So within this snapshot in time, this many people are known to have this specific outcome or risk factor. Okay. So we remember this, right, from a few weeks ago. So observational designs, okay, types of designs. Now, here's the deal. With types of observational designs, the one thing that you notice about these is that all of these, okay, all of these are observational in nature, right? And we are not attempting, what's the one thing we're not attempting to do? We are not attempting to manipulate the independent variable, to assess its effect on an outcome. That independent variable is allowed to be described and occur naturally within the environment in order to assess its effect on the outcome, okay? Okay, so obviously we know that with a cohort study, we're able to follow two or more groups over time, obviously based on specific exposure to a variable, right? And so if we're following them from a specific point in time forward, okay, we are looking at prospective data, okay, prospective data. Obviously, conversely, right, if we are starting from, at a future point in time and we are looking backwards, okay, that those data are obviously retrospective. So, and the example that we give here is with a case control study. We are obviously, looking retrospectively, potentially at medical records and or other types of factors between maybe one group that has a condition to those who don't, right, to attempt to determine the cause or contributing factor for that condition, right? And then obviously cross-sectional surveys are based on survey data that we obtain from questionnaires. And those are obviously, things that we collect at one point in time. And it's through that data that we may be able to make inferences or have ideas about future data. Okay, here's the deal. Okay, causality. How do we measure causality? So first of all, guys, when I say causality, what do I mean by causality? Who can tell me what I mean by causality? Okay, so chat, here we go. All right, so Peyton says, yeah, like the cause and effect relationship. So Peyton, yeah, you're right. So we're looking at the cause and effect relationship. So ultimately, okay, causality, right, is essentially the establishment of the cause and effect relationship and a demonstration of the strength of that relationship. All right. So, and I know you guys have done some of this with Dr. Ott already. You guys have talked a little bit about correlation, right? Okay, cool. So obviously we know correlation is a measure of the degree of association between variables. So ultimately so a question that we could ask, is how likely is it that a change in, X variable relates to a change in the outcome of interest? For example, how likely is it that a decrease, excuse me, so we'll say weight loss or a decrease in obesity is related to a change in hemoglobin A1C and or like the essential the severity of type 2 diabetes and or type 2 really. And so we typically measure these types of things with regression techniques. Now, here's the thing. Okay, when I say that that these things also have to have a dose response relationship, what that also means, right, is that for an increase in the independent variable and or the risk factor in this case, the more of the risk factor that is present, right, it should be more likely that the outcome occurs. Okay, so for example, the more the higher the BMI or the higher the level of obesity within a certain patient population, then the higher the level of the outcome, meaning type 2 diabetes, meaning metabolic disease, those types of things, right? So those are factors that we look at when attempting to establish a relationship based on causality. Okay, so here's the thing. Whenever we look at right? Whenever we look at observational data, particularly data that is retrospective, right? We are looking back at data that has already been collected. And that process of looking back at data that's already been collected and utilizing that to formulate a new research question is called secondary analysis. Okay, so obviously, if I wanted to look at, rates of, let's say I wanted to look at, rates of neck injury, right, in football players, during the course of a football season, right? I've got an option here. I can take a look at the Data List Center and their high school Rio program and/or their, oops, sorry guys. Okay, I could take a look at their, High School Nation, which is essentially a collection of data, injury epidemiology data from the high school setting for athletic training, right? I could look at rates of injury based on that data, right, as that data is documented. Another example of this is, the NCAA and the Department of Defense developed essentially a care consortium for concussion based on data that was present from the NCAA injury surveillance system, right? So those are also that's another database that was utilized to pull data for creation of research questions as well. So those are just some examples of how secondary analysis can be used, right? So, guys, we'll obviously get a little bit more into the details on this on Thursday with our next lecture, but it's pretty much it. Just a couple of updates for today. I am working on exam 2. I know I opened that up for you guys, and I'm working on getting that graded for you guys. So that you should be seeing that within the next week as far as grades there. And like I said, I do apologize, but I will have those lectures, the asynchronous lectures posted for you guys ASAP, hopefully by tomorrow and or Thursday. Okay, those will be up. Those are just going to be some videos you guys can work through. And so, yeah. You guys, any other questions at all? Any questions before we call it a day? Anything that you guys need help with, have questions about? Throw a question in the chat or just unmute yourself. But all right, well, guys, you guys are doing great. Hang in there. We're over halfway there. All right. Thanks for hanging in there with me today, and I will see you guys on Thursday. Okay.
Thank you.
Thank
Take
you.
care, guys.
Thank you.
Thank you.
Yeah, guys.